Hi, welcome. As we celebrate the inauguration of Dr. Clark as the new president, I want to thank everyone for the opportunity to share with you our research project that we undertook this year. So to do research for our biology students has always been something I want to do. But for chemistry, which rely heavily on experimental instruments, funding, and graduate students, it always seemed impossible. I'd say it is through divine providence that this project came to be. So I'm kind of going to share the journey a little bit. So last summer, I had the opportunity to go to Dr. Mariah Lieberman's lab at Notre Dame to conduct research on paper microfluidic analytical devices called PADs. So it's Paper Analytical Devices, the shortcut. These are test cards that are simple and innovative, designed to solve the prevalent problem of counterfeit and substandard pharmaceuticals in developing countries, in Africa, in Asia. The motivation behind this project are two aspects. One is the prevalent problem of counterfeit and substandard drugs in the low-resource countries. We don't have an accurate statistics, but people have reported could be over 30 to 40% of the antibiotics in some of the African countries that are counterfeit. Another situation that motivated this whole project is the financial problems in those countries to come up with expensive instruments to actually test out these drugs. So Dr. Lieberman designed these paper analytical devices. So this particular one is actually one of them that she sends to Kenya and some other countries in Africa to screen the over-the-counter drugs. So we got funding from National Science Foundation to not only study this project, but also we had the ambition to bring this project to undergraduate research and also undergraduate experimental lab curriculum. So, so with that, another piece of puzzle came in. We wanted to design an inquiry-based lab for our science students because most prevalent labs are cookbook manual kind of lab. And we want to put in more investigation, open-ended procedure design for the students. It also happened that this was even before I came to Holy Cross. I spent a couple summers at ACE, STEM division of the ACE at Notre Dame. To actually, we did research on lab design, STEM education, and how to bring an inquisitive, more inquisitive type of lab into high school classmates. So that piece of puzzle and this research came together there. So in the fall of last year, I finished my research. I came back to Holy Cross, and there's this group of freshmen came into some sophomore, but mostly freshmen came into Holy Cross to my general chemistry classroom. And I picked a few of them. Actually, they're actually sitting here. I picked a few of them, called them to my office, and I gave them a few PhD level research publications. And I said, I want you guys to read it, try your best to understand it, and make a presentation about this to your classmates. They kind of looked at me, not sure. I said, just try your best. And they did it, and it was amazing. So actually, one of them are going to represent the group to be part of the presentation. Anyway, in the spring, we gathered a few juniors to start this research group. So we have Laura Morris, Justin Friesen, Morgan McGinn, do I say it right? Magini, and Annika and Tamina Beer. So we have them come together. I'm not biased, but they're the best group that you could work with. They're hardworking, they're creative, and they're passionate about this project. So they are going to today present the details about the project. And I kind of wanted to say this is not like half year of work, it's 2 months. So they started end of January, this is March, hardly 2 months. So, so that was the research group that we started, and they learned about the pads. They also helped me to design the lab actually for our general chemistry students. They have actually quite a few of them had worked as TA, teaching assistant for me and for some other biology professors, so they really know about the undergraduate lab, so they were giving me advice on that and too. So a couple weeks ago, we visited Dr. Lieberman's lab, and we had a really good time, and she was able to broaden the scope for them and for me. She talked about some other research area that involves pads, and she talked about, after the pads screened out the fake drugs, what's the next step she does to further identify the compounds, what's in it. We also talked about going into the possibility of going into STEM PhD. Luke was in the group. He can't be here, but he actually went back to some of their group meetings, and one thing they were excited was that if you go to STEM PhD at Notre Dame and some other universities, you not only get tuition free, you also get paid almost like $30,000 stipend. So that really was inspiring, and a lot of them are thinking about their future, so it kind of brought a bigger horizon to our students. So another piece of puzzle that came into this whole research project is, as we are doing it and we are pipetting this trace amount of compound on these cards, I'm just amazed, how cheap, how safe these experiments are. And it kind of dawned on me that this would be a great project to be moved into high school labs and even long-distance learning chemistry settings or homeschool settings. So recently, I emailed the president of a local high school, and they're pretty new. They're working on setting up their high school science program. I emailed him some information about this project. He emailed me back within 10 minutes. He was like, fantastic stuff. Because we could not only use these pads for drug identification. We could use it for acid-base titration, study of surface tension, and many other areas. So that's another puzzle that's coming into play. So I felt like this, while doing this research, doing this project, it felt like it's like a network is coming about. We have collaboration with Notre Dame. We possibly could bring this to high school classrooms and labs. And then within the college, we're bringing freshmen, sophomore, juniors, seniors all together to investigate this this research topic and to work together to do inquiry-based lab. So I'm very grateful for all the possibilities through the hard work and the support of many in the college. I want to kind of mention that we're really grateful to Dr. Lieberman. She is always there to help us and support us. No question is too small for her. She always welcomed us to her lab, and just a great role model that she dedicated herself to the common good of not only the world but the local community. And also, I'm grateful to Dr. Fox, who she's famous for doing research, so she gave me a lot of good advice, and also the support from my colleagues in the science department. Thank you. So I'm going to have the students come up and tell you a little bit more in detail about the research.
Should I take that over? Okay. So Professor, is that on? So Professor Zhang already gave you a lot of information, but I'll give you some more numbers to the background information of PET scans. So the sale and use of substandard medicine is still very prevalent in developing countries and has life-threatening consequences for all the patients taking these medicines for several reasons. It is estimated to be the cause of 300,000 deaths each year worldwide. The use of this medicine is life-threatening consequences because especially cancer patients take the medicines with a precisely calculated for each patient. But then if you take the medicine and it turns out that only half of the things that you're actually taking are true, it has bad consequences for your health since the symptoms don't go away, they get worse and worse and worse, even though you think you're taking medicine. The other consequence of that is that people lose the trust in the public health because they're taking the medicine, but they're still not getting any better. So as a consequence, they won't go to the doctor anymore. They won't start to seek help if it's time for that. So more and more people suffer from consequences that could be avoided. It is estimated that 1 out of 10 of these medicines globally are counterfeit, and in developing countries and parts of Asia, it's even worse. It's estimated that more than 3 out of 10 medicines are actually substandard. So it has great consequences, and the sad part is it's not an issue of chemistry because you could test drugs before you use them, but it's a lack of financial issues. These countries don't have the techniques or the machines to test their drugs, so the patients have to suffer the consequences. So Dr. Lieberman came up with the PET scans, which are perfect for these countries because these scans are super cheap, so they are affordable for all the people living there. They're only 45 cents per scan, so they can easily get them, test their drug before they use them, so they're sure they're taking good medicine that will actually help them and improve their conditions. As I just said, they're super easy to use and they're quick. It's a qualitative analysis, so you swipe the pill across the PET scan, you get a color code, so you can compare that right away and know if you're supposed to take the drug or wait till you get something better. It doesn't require a lot of training since it's a super easy process. Many people can learn it, compare colors to each other, and then see if they should use it or not. Another big advantage is that they are super easy to store. They don't need a cold room or some special treatment. You can just store them in a normal room between 4 degrees Celsius and 25 degrees Celsius. And the best part is that even though they're so easy and quick to use, they have a high sensitivity and specificity. So you can actually rely on the results and not use them if they're not what you should expect.
So Dr. Lieberman had a connection with Holy Cross Congregation, and this is how a big part of this research got started. So she was in research before she started pioneering this, and from what she told us when we went on the tour of her lab, she was kind of unsure where she wanted to go to next. And so she had the opportunity to visit to Kenya to visit the mission areas of the congregation. And over there, she saw a big area where her expertise could be utilized. She saw that the pharmaceutical market is very unregulated and very unsafe, as Tamina has pointed out. And so she knew that she could step in and help these people out. So what she started to do was this research. And there's different ways to go through and quantify the results. And the first way that she did it is that reporting important results to the local officials was the first step, and then going through and reporting the more severe stuff to the WHO, the World Health Organization. Which important and severe don't sound too different, but the way that she quantified it as looking at the percentage of antibiotics in the drug itself. So a pill for an antibiotic will never be 100% of that specific drug. It might be 60% and some binders to help keep it together. So when they tested it and they saw that it was supposed to be 60% and it was only about 40, that'd be considered important. If it was anything less than that, like 20%, it'd be pretty severe. So these patients are getting none of the actual antibiotics that they need. And so from that, she came back to Notre Dame and started up her lab.
So you might be wondering, what is the importance of these pads, these paper analytical devices? And basically, the gold standard for testing fake antibiotics is called HPLC, or high performance liquid chromatography. But the issue with this method is that it's very expensive and it also takes a long time to get results back. So what happens is that in these countries where they tend to bulk buy these antibiotics, but when they bulk buy them, they're a lot more affordable, but often these cheap antibiotics lack the actual antibiotic. That's why they're so cheap. So then what happens is that by the time these HPLC results are back, when they find out, okay, these antibiotics don't have what we're looking for and they're not going to actually help the patient, those antibiotics have already been sold and given to patients. So that's one of the big struggles they're having with all these fake antibiotics popping up. And then what happens is that this basically fake medication is killing patients because they're not actually getting their proper treatment. So Dr. Lieberman performed a study in Kenya with some other researchers, and basically what they did is they wanted to see how they could implement the pads to help their HPLC testing units get the results quicker. So here we have just a graph here, and scenario 1 at the very top is just regular HPLC testing, and what you can see is that after about 19 months, that's when they actually end up getting the results back, and they could take the antibiotics off the shelf. Unfortunately, like I mentioned, that's when it's already been sold. So the damage has already been done at that point. And then what they did is they did expedited HPLC. And basically what that means is that they took 25% of the antibiotics they wanted to test, and they would test those at a time. So they would get some of the results quicker, but other results would still take the full 19 months. And what they found was that it took around 11 to 19 months to get the results back. So it was better, but still wasn't fast enough. So then what they did is they said, okay, let's take these pads, and when you use these pads, it only takes about 1 to 2 minutes to actually see the colors that show up on the pad, and it can tell you whether there's no antibiotic or not enough antibiotic. So what they did is they took the antibiotics they wanted to test, they used the pads, they got results back, and they only sent the antibiotics that failed the test to get HPLC testing. And they sent another 10% as a control. And so on average, when we talked to her, she said around 10% of these antibiotics end up failing the pads. So when you take that 10% plus an additional 10% as a control, they're only actually testing 20% of the antibiotics instead of testing 100% of the antibiotics with the HPLC. So what this allowed them to do is test way less with this HPLC, saving a lot of money and a lot of time. And what they found was that in the third scenario when they did this, they got all the results back within around 9 months, which is way faster than the initial 19 months. And on top of that, the nice thing is with the pads, let's say you swipe an antibiotic across it and you find out, okay, there's a very good chance that it's fake, or there isn't enough of the actual medicine. Well then what you can do is you can take that antibiotic off the shelf right away and then wait for the HPLC results to get back to figure out if it actually is a fake antibiotic. So that way you're not giving any of these fake fraudulent antibiotics to patients, which I thought was pretty interesting. It's actually a very significant change. And so the main antibiotic they were testing for was amoxicillin. And that's an antibiotic in Kenya, which is typically used to treat childhood pneumonia. And what they found is when they did this third scenario, throughout the entire year, they saved around $15 million US. And for a country that doesn't have a lot of money to begin with, that's actually a very big change. And they found that childhood pneumonia deaths dropped by 586.
So to use these pads for testing, you're gonna get a sample of the drug and then you're gonna swipe it across line 2. As you see right here, that's the swipe line. And then you put this pad in a small shallow dish of water and you let the water rise up through capillary action to get to row 0 or about 4 minutes. And then you should take it out immediately to see the colors because some colors will fade. And so to get the best results, you need to look at it like right away. And then you can compare the colors above row 2 to see what drugs are in the sample that you're testing. And some colors will stay at the swipe line, and that's because these products are insoluble, but other ones will rise to the top because those are the soluble compounds in the drug. So these are the test pads that we're using, and instead of the wax pads that Dr. Lieberman was using, we're doing paper, and they have these rows on them that are separated by air and can be using hydrophobic separation. And the wax pads, they're no longer being produced as much because the wax printers, they're not being produced at all. So Notre Dame has a small limit of how many they have left, and they're very old. Also, these pads that use the air as separation, they can be mass produced in Elkhart, and it's a cheaper and more efficient way to get these pads and be able to have more produced in a shorter amount of time. And so for our research that we've been doing, we personalized a card to label it for Holy Cross, and we have Holy Cross 2023, and where we can put what we're testing on it, and then we have the A through G on the top for the lanes, and then we'll have numbers on the sides for the rows. And we use this machine called the Frog. And so we put the solvents in a tray like this one, and then we can stamp the frog in it and then stamp it onto the card to put them right in the place that they're supposed to be on the card to save time and be more efficient.
What you're looking at right now is what we use to set up our pads. So these are the examples that Dr. Lieberman produced herself when she was working on and gave to us. So every good experiment, you need to be able to reproduce your findings, especially have other labs reproduce it. So that's what we started with when we did this research. Right here is called test card 4, and you can see that we were looking for starch, baking soda, and chalk. And so we went through and did that, and we only tested one at a time to make sure that we got the same results that she did, to ensure that, again, it was repeatable. And then over on the completed pad, so there was 4 different test cards, all of that was combined into one, as you're looking over there on that one. Okay. And then from all of these experiments, we were able to come up with our own color standard length guide. It's actually a very simple thing to read. So example of for lane E, you would have iodine on this lane, and then you're testing for starch. So when you put it into the water and you're reading it, if you see that it turns a very dark purple and fades, you know that you have starch present in your pill. And down here it says shift or no shift, and that's looking at your if it's soluble or insoluble.
So in our research, we've been using mystery pills that we make up ourselves, and we put them in these little pill samples, and we take a little sample of it and we swipe it across, and this was mystery pill 4 that Professor Zhang produced for us. And we mix the substances well so that it's consistent throughout the entire powder, and then when you put it on the swipe line, all of the substances will come out from each lane. And as you can see here at the bottom, like this is chalk, baking soda, and then chalk and superflaxes. And those will stay at the lane, at the swipe line, because they're insoluble, and those are what they put in the products, so, or the drugs, so that they're not completely the drugs. And so for mystery pill 4, we can see here in lane B that it's a dark blue, and this means that there's beta-lactams in them. And then in C, you can see that it's like an olive green, and that is what shows us that the beta-lactam that's in the pill is amoxicillin. And then in lane F, you can see a small amount, and that's the chalk. And I forgot that lane D, that is what you can see the acetaminophen, because it's a darker red. And so Professor Zhang made this pill with 40% amoxicillin, 30% acetaminophen, and 30% chalk. So we can deduce that from these pills and from our pads and be able to decide what's in them.
And from this, we were designing a lab for the general chemistry students. And the reason why we're doing it is because we can, and it's a very interesting thing to bring to the lower level chemistry classes. A big part about it is that it takes away from the procedure, cookie cutter experiments that we do. While they are very important to get proper lab procedures down, we need to expand more into inquiry-based experiments. This just really helps to develop students to be better thinkers and care more about what they're working with. When you go through a procedure by procedure lab, it's very easy to get bored of it and to lose the focus, but with something like this, you're actively thinking of what you can do to improve it. How can you make this better, and how do you understand it better? And not only that, it really does help connect the concepts taught in general chemistry, so that way it's no longer just a concept on a slide, but you're actually understanding how it is applied in real life. And not only that, it is a really good gateway to organic chemistry, which is the class that students will take after they complete their general chemistry courses here.
I'm going to use the speaker because it's better. Okay, so some current and future research that both Holy Cross College and Notre Dame are doing regards antibiotics, chemo drugs, and illicit drugs. So when looking at antibiotics, this regards the low-cost test cards for quick field screening of prescription dosage forms, including beta-lactam antibiotics, or mixtures of the 4 first-line anti-tuberculosis medications. And so these devices, they look for alternative drugs like acetaminophen and chloroquine that might be included in these fake medications, as well as active pharmaceutical ingredients. So these are known as APIs. And regarding antibiotics, it's less of an urgency for feedback simply because the doses are not as sensitive as you would look at for chemo drugs. So when looking at chemo drugs, we want to get more familiar with the chemo pad, because the chemo pad creates a unique color bar code to identify each medication. And so the internal validation studies show that the chemo pad has excellent sensitivity and specificity to differentiate between samples of 100% and 0% API. And so this distinction is really relevant because you want to be able to report the falsified chemotherapy cases. And so with these falsified chemotherapy cases, we actually got to hear about what Dr. Lieberman's work was in Africa. So in Africa, Dr. Lieberman and her class actually tested a lot of the chemo drugs. And what they found was the concentration in these chemo drugs were not ideal. And so when they're not ideal, chemo drugs are actually, they have an urgency. that is required, unlike antibiotics. So if you find the concentration being lower than it should be, the ideal state, these patients are quickly dying off, or that they are not getting the proper treatment or procedure like they need. And so we go into illicit drugs. We're zoning in more on fentanyl, and we're looking at more prevalent areas, so South Bend, the local community, and also areas like Chicago. So unfortunately, drug overdose, it's continuing to rise, and the spiked deaths regarding fentanyl are also a big concern. And so this increases the interest in the field testing of illicit substances. And so the paper-based analytical device known as the ID pad, this concerns 12 colorimetric tests at the same time, each detecting different chemical functional groups and materials found in illicit drugs, distractor substances, and cutting agents. So future research includes this colorimetric paper-based devices that enables fast analysis with just a smartphone. So you can see here, we're looking at an example with the ID pad. And so you can see on the bottom, they're taking a cocaine sample that's adulterated with phenacetine, which is actually a cutting agent. And so you're looking at the ID pad, which is in the center, and you can actually, for future research, be able to use a smartphone to be able to detect the phenacetine in the cocaine sample. Or you can look at, with your just naked eye, you can detect even a more solid color that leads to the idea that there's a higher concentration of the phenacetine in the cocaine. So using pads as a worldwide tool, in order to reduce harm and prevent accidental overdoses, drug testing services are used all over the world to notify drug users about the makeup and contents of these substances. And so the fentanyl crisis, Notre Dame is collaborating with DanceSafe. And so DanceSafe is a nonprofit harm reduction organization that provides test strips of all sorts, but mainly including fentanyl test strips. And so we get into the main issue with the pads is that sometimes there are false positives. So to get a more accurate idea of what is in these illicit drugs more specifically, this is where a secondary analysis tool comes into play. And so secondary analysis tool for pads, like said before by Justin, HPLC is a great secondary analysis tool to be able to use. But I'm also getting into the LC-MS-based techniques. And so although a lot of companies do not use this because the techniques are for usually initial or subsequent analysis, this is actually a great tool to use when looking at illicit drugs because you want a more subsequent analysis. You want a direct analysis. So in hopes of tackling this 22 illegal narcotics and cutting agent, LC-MS methods were created and applied to 124 illicit drug samples that were actually gathered in Chicago. And so if you look at this image, it's a simplified image of the LC-MS method. And so what you see here is you have data that's collected from the LC separation. So MS comes into play when ionization and the magnetic field can actually detect the different concentrations that you can find in these illicit drugs. And so this picture, once again, it just shows the importance of having that pad as an initial collection. And so doing research for the Paper Analytical Device, you guys see for the collection, the pad, you can actually extract what it is that you found to be sus or something that wasn't ideal in that specific drug of choice. And so this idea of this secondary analysis tool coming into play is to be a little bit more accurate once you do find this initial like sus whatever in the drug. And so once you do the LC-MS analysis, you can actually report all types of different drug analysis.
So the bigger picture. As you guys can see, chemistry is not the issue, it is part of the solution. And the chemistry is consistent, whether it's at Notre Dame's lab, our lab, or even at the site where these antibiotics are being tested, chemistry has proven it works. So why hasn't it been fixed? Well, it's a very big combination of the economic climate, the public health regulations, law, and politics in these areas. A lot of the times it is the people within these boards that are supposed to be protecting their citizens are benefiting from the sale of counterfeit drugs. So they can still continue to support their families and not really worry about what else is happening. So it's just dealing with the corruption in these areas, and not only that, but helping build up the public health relationships. As stated earlier, in a lot of these places, the relationship with the public health officials and citizens is destroyed. So why would they listen to the people that said it was safe before that they're fixing it now? So there's a lot of work that needs to be done, and chemistry is a wonderful foundation for doing that. Thank you. Thank you.
All right.